folks, this is Dr. Paul. Thank you very much for tuning to our channel today. Today I want to talk a few minutes about liver benign neoplasms. Like you will understand about carcinoma, malignant neoplasms in a separate lecture. But in today's lecture, I want to focus just on benign neoplasms. First of all, cavernous hemangiomas, focal nodular hyperplasia, hepatic adenomas, they are the most common. I want to show you the screen so that you can understand. Otherwise, it's very easy to get confused with these three things. So remember, cavernous hemangiomas, focal nodular hyperplasia, hepatic adenomas. These three are the most important to remember. Cavernous hemangioma is the most common benign neoplasm of the liver. Remember that. It's like even in children, this is the most common benign neoplasm of the liver, and more than 80% occur in women. Then focal nodular hyperplasia. This is the second most common after cavernous hemangiomas, and it occurs at all ages. Then hepatocellular adenoma is most commonly in women aged 20 to 40, and it is usually caused by oral contraceptives. So it's very important to remember that. Oral contraceptives. If you see a question, oral contraceptives, and it is asking about a benign liver neoplasms, always think about hepatocellular adenoma. And symptoms and signs, most of these patients come with asymptomatic problems, like you don't even see any symptoms. In fact, in cavernous hemangioma, it's an incidental finding. You will take a ultrasound and CT scan, and we will find a hemangioma in the liver. So it's an incidental finding. But when it is symptomatic, patients can have an abdominal mass, bleeding, nausea, vomiting, and early satiety. Then diagnosis. Pretty much remember these things: ultrasound, CT, MRI. And there are certain characteristic features that are diagnostic. For example, if you see a central scar, that is focal nodular hyperplasia. If you see a spoke wheeling on ultrasound, that is focal nodular hyperplasia. If you see a hyperechoic mass, then it is hepatic adenoma. And for hepatic adenoma, hepatic angiography is the most valuable diagnostic tool. Treatment is easy. If they are asymptomatic, you can always keep them alone. And if they are symptomatic, consider surgical resection. So if they don't have any symptoms, then you can observe and monitor the situation, especially with focal nodular hyperplasia and OCPs. In these patients, you don't have to discontinue OCPs. They can continue oral contraceptives. And you can do an annual ultrasonography for 2 to 3 years. And if the tumor does not grow, then you can just continue giving them oral contraceptives. And hepatocellular adenoma, if they are symptomatic, resection. And you can also do percutaneous radiofrequency ablation. Now, when do you actually do resection? If the tumor is more than 5 centimeters, then you should do resection. Remember this. And if the tumor, even if it is less than 5 centimeters, but if it is beta-catenin gene mutation, if you see beta-catenin gene mutation, even if the tumor is less than 5 centimeters in diameter, you should resect the tumor. So those are the things I wanted to tell you today. Hope those things